situation across the whole of Gaza is absolutely desperate. So over 2 million people are at risk right now of famine. These 14,000 children that Tom Fletcher refers to are children who are acutely malnourished with a severe acute malnutrition that they will be seeing in the clinics that they support. And the children have seen in the clinics that we're running in Deir al-Balah and in Khan Yunis an increase in the number of children being malnourished. And of course, there isn't enough water. You said 11 weeks that no supplies have entered Gaza, no food has entered Gaza, there's no shelter, there's no equipment to support children. The situation is absolutely desperate.
Now we're hearing from the Israeli government that 100 trucks will be allowed to go in. Is this enough, in enough time, to help alleviate that fear of losing those 14,000 children?
You know, whilst of course we welcome any aid supplies that come into Gaza after 11 weeks of a blockade, that is not enough. There's over 2 million people at risk of famine who haven't had access to adequate food supplies in all of these weeks. Now, during January to March, when there was a pause in the hostilities, 600 trucks a day were entering Gaza with essential life-saving supplies. So although we welcome the supplies to come in, we need many more supplies to enter Gaza.
So what needs to happen? What is the ideal amount of aid to come in? Sometimes some of the counter-argument to getting that aid in is that it's going to be looted right away, or that it doesn't get to the people who need it, and that Hamas takes the aid.
We need a ceasefire and for this war to end. We need the supplies to come in at the rate that is required, 600 trucks a day, but obviously with the right equipment, the right supplies. Remember, there's been no medicine, no healthcare equipment has entered Gaza in 11 weeks. So the hospitals are overwhelmed and they don't have enough supplies. So we know as a humanitarian community, as a humanitarian agency, how to respond to this crisis. We know how to treat malnutrition, we know how to prevent malnutrition, and we need the supplies to come in. And of course, we also need access to populations. It's a very volatile situation, very active conflict, and we need to be able to move our staff around, have our staff providing those services. But in terms of the looting, people are absolutely desperate. They haven't had food for weeks and weeks and weeks. And it's Save the Children across other sectors, across other agencies. We've been doing this work for a very long time. We know how to monitor. We know the accountability mechanisms we need to make sure that the humanitarian supplies are reaching the people who are most in need.